questions you will get on sarcoidosis. First of all, remember it's a widespread non-caseating granulomas similar to TB. So when you have a patient complaining of pulmonary symptoms, cough, fever, dyspnea, weight loss, and you start suspecting TB, but you do a TB test and it's negative, so the tuberculin test is negative, that's when you start thinking of sarcoidosis. Also notice the elevated ACE levels and the elevated CD4 to CD8 ratio. And how do we remember the CD4 CD8 ratio thing? We'll always put in mind that CD4, when it's high, it activates interleukin 12 and tumor necrosis factor alpha, and these two together, they form the non-caseating granuloma. Usually it's going to be a middle-aged black woman, so 30-40 years old. Pay attention to that too. You have to be familiar with the chest x-ray showing the bilateral hilar lymphadenopathy, and also be familiar with the histology showing the non-caseating granulomas. These two, the x-ray and the histology, sometimes might be the key to the question on your exam. Don't forget the association here with endocrinology, where they might ask you about vitamin D levels, calcium levels, and parathyroid hormone levels. In sarcoidosis, vitamin D levels will be high due to the activation of macrophage. Subsequently, calcium will be high, and by negative feedback loop, parathyroid hormone will be low. Don't forget, sarcoidosis has pulmonary and extrapulmonary symptoms. The extrapulmonary symptoms could be used as hints in the case. Things like uveitis in the eye, they love that. Things like lupus pernio, large nose, red nose. Also, they could mention cutaneous findings like erythema nodosum on the shins of the tibia. Sarcoidosis also affects the cranial nerves, causing Bell's palsy or cranial nerve 7 facial palsy. It could also affect the heart, causing AV blocks and restrictive cardiomyopathy. So they can show you an ECG showing an AV block, or they can give you a restrictive pattern cardiomyopathy, and you have to identify the pattern. They could also mention parotid enlargement or peripheral lymphadenopathy in anywhere, so beware of all that. And for step 2, they like to ask you about the diagnosis and the steps of diagnosis. So the best initial test is to do a chest x-ray, and you will find the bilateral hilar lymphadenopathy. You could also see coarse opacities or lung opacities on chest x-ray. Next best step, if chest x-ray or CT are suspicious, you have to do a lymph node biopsy, and that's when you're going to see the non-caseating granulomas. You can also order a pulmonary function test, and you will find a restrictive lung disease pattern with a decrease in the DLCO. Other lab findings, things like high alkaline phosphatase if the liver is involved and it's a cholestatic pattern. If the heart is involved, you will find arrhythmias or AV blocks, third degree AV blocks on ECG. So once you're familiar with the lab investigations and the pulmonary and extrapulmonary symptoms, you're good. Last thing we were talking about is the treatment of sarcoidosis. If the patient is asymptomatic, then we just observe the patient. If the patient has systemic manifestations, pulmonary or extrapulmonary, we can try corticosteroids because it's an inflammatory condition. Sometimes we use methotrexate or azathioprine. We could also use NSAIDs, a trial of NSAIDs for some specific symptoms. That's it. That's all you need to know about sarcoidosis.